Good evening. My name is Dr. George Rogu, and I'm coming to you today from adoptiondoctors.com. I'd like to speak to you today about why do people choose international adoption as a method to complete their family unions. There are numerous reasons why parents choose international adoption, but each case usually has a unique story attached to it. Some people have an affinity for a certain culture, some for humanitarian reasons, and some believe that the risks are less than those for domestic adoptions. Whatever the reason, a family considering international adoption must be well informed and be able to accept the risks and realities associated with international adoption. Some of the risks that are associated with international adoptions are there's a lack of information often. The information that is received on a child sometimes is minimal. Sometimes the referral information has very little to do with the history of the birth mother. The child may have a genetic predisposition for medical or psychiatric illnesses, which may not be told by the family histories because it's not provided. Oftentimes there's a history of alcohol or drug abuse, and that can be ignored. Many times we don't know if there's prenatal care of the child during the pregnancy period. Many times the complete orphanage records are not sent. Sometimes diagnoses are made on the report and tests are performed that don't make any medical sense to the layperson. When parents are lucky and they actually receive a medical report, they will receive some information in terms of growth parameters, some past medical history on the child, or what may have occurred during their stay in the orphanage. I'm seeing recently more and more videos and pictures of the children. While most children that come from international adoptions are considered at least a minimal risk, when you take this information to an adoption physician, they may uncover some other more specific problems that may not be observed to the lay person. Sometimes we have some medical uncertainties. Countries where children are primarily adopted generally have inferior medical care. They have limited diagnostic capabilities, and the health standards for these children is far less than for the general population. We often find children, they have some kind of infectious diseases associated with having many children in a small confined area. Viruses, infections oftentimes sweep through orphanages. And children in orphanage tend to have frequent colds, ear infections that may not have been treated because they were either not known or they were ignored or there was nobody to take care of them. And many of the children have built up some immunity to some medications where medications are given arbitrarily to children, and sometimes they can get some hearing loss. The orphanages in general don't provide a well-balanced diet. Some of these children are small, they're underweight, and they can have long-term medical complications over time. The lack of a balanced diet and deficiencies in different vitamins, basically, if you think about it, there is a lot of children with very limited resources. They do the best they can to take care of these children, but when the child is malnourished, there can be some associations with some developmental delays, poor muscle tone, and other medical conditions. Sometimes the environmental conditions in the orphanages are hazardous to a child's health. There's air pollution, water pollution, there could be some lead paint because a lot of these orphanages are very old. Sometimes there's alcohol abuse of the mother during the pregnancy, cigarette smoking. Unfortunately, cigarette smoking in overseas countries sometimes is an acceptable behavior even during pregnancies. Oftentimes, on the reports we see children with special needs. Now, the definition of special needs does not mean that the child has dramatic physical disabilities or medical conditions. Sometimes it's mild medical conditions, and you need to tease out what is severe and what is not. The simple lack of medical and social history, lack of medical care, inaccurate referral information can put this child at a special needs risk. Although some adoption physicians may be capable at diagnosis of visible medical condition, there is little that we can do in terms of the psychological insults that these children receive, or the emotional impact of living in orphanage conditions or foster care conditions that can lead to long-term difficulties. Many children are described on the reports, unfortunately, as very healthy, and you look at their report and there's a list of like 10, 15 different problems, or you have a list of problems that look scary to the layperson, yet when you look at the child and you try to tease it out, the children are actually pretty good, and you wonder, why does this child have this? No one can predict the future of a child's medical health, but we can at least try to decipher whether there are some issues in there, either in on the maternal's medical intake, or during the stay in the orphanage, or how long the child has been there, how many doctors did they see. I'll give you an example of, I received a case from Hungary, where there was many pieces of paper, and there was some twins, and initially they were premature infants, very small, and I thought to myself that, oh boy, this is going to be a problem case. And then as I dove deep into the medical reports and tried to weed out the medical data that was in there, I came to realize that these children were born in a central big town, Budapest, and the care that was given to them was exactly the care that would be given in the United States to these premature infants. They had all the specialty care, all the neonatal intensive care treatments, protocols, and surfactant, and everything was done appropriately. Now, I'm seeing records from the past, and I'm seeing the videos of today where the children are 3 years old. So I can tell at 3 years of age, are these children terribly handicapped? Will they be wheelchair bound, or will they just have some mild developmental delays? To my surprise, their videos were really appropriate. They were great. Mild delays. The therapy that was given in the neonatal intensive care was appropriate. So I was able to tell the parents that yes, they are at risk of future problems, but I did not feel that these children are set up for devastating, life-altering medical conditions that would affect the parents' lifestyle in the future. So they were able to make an educated decision as to whether to adopt or not adopt these children. So, but by looking at the initial reports without the help of a physician, it could get a little tricky. It could get a little tricky and scary, and you don't know if you're making the right decision. The parents were, they wanted to take the children, but the father was a little bit on the older side, and he wanted to make sure that these children would be able to live a full life on their own after they pass. And I told them that they probably would be okay. Maybe they won't go to like an Ivy League, Harvard, or Ivy League college, but they definitely will go to college of some sort. So another happy case. So this is Dr. George Rogu from Adoption Doctors signing off. If you ever need any help with consultation services or education, please visit our website, adoptiondoctors.com. Have a good day.